presentation is titled Integrating Clinical Pathways into Your BPSO Journey, Fairmount Home from Glenburnie, Ontario. I would like to introduce you to today's presenters. Anna Campbell is a nurse practitioner with over 15 years of nursing experience across acute care, palliative care, oncology. Since graduating from the nurse practitioner program at Queen's University in 2020, Anna has been dedicated to providing comprehensive geriatric care with a palliative approach, aiming to optimize quality of life for individuals living in long-term care. She has a strong interest in evidence-informed person-centered care to improve individualized outcomes. Anna values the role of ongoing education and knowledge transition as essential tools in advancing care practices and supporting both patients and teams. Let me introduce to you Peyton Hunt is a registered nurse with a strong commitment to geriatric care in long-term care settings. Since joining Fairmount Home in 2019, she has grown into her current leadership role as Assistant Director of Care, where she supports staff, enhances resident outcomes, and fosters a culture of compassionate person-centered care. Peyton is passionate about improving practices in the LTC and creating environments where both residents and care teams thrive. That's wonderful. Peyton and Anna, it is a pleasure to have you here with us this morning and really looking forward to your presentation today on integrating clinical pathways throughout your BPSO journey. And I'm going to hand it over to you. Thank you so much.
Thank you, Julianne, for that introduction, and good morning. As Julianne had noted, we're going to be talking today about integrating clinical pathways into your BPSO journey. I actually don't think I have control, Julianne. Oh, now I do. Thank you. I'd like to preface that we are in no way experts on this subject. We are approximately 1.5 years into our BPSO journey and about 9 months into integrating clinical pathways. We continue to learn about both processes as we move forward, but we wanted to share a bit about what we have done, what we have learned, and where we are going in the future. So our learning objectives for today is to review and discuss the early stages of integrating BPSO into long-term care, review the implementation and challenges of clinical pathways, and analyze how BPSO and clinical pathways integrate and some of the lessons that we have learned as a home. It doesn't seem to want to move forward. Thank you. So Fairmount Home was established in 1968 and is a 128 long-term care home. 128-bed long-term care home. We have approximately 49 regulated care staff, 96 unregulated care staff, and about 55 support staff. As with all long-term care homes, we are governed by the Fixing Long-Term Care Act of 2021, and our board of directors is the Frontenac County Council. Our home is guided by our gentle care philosophy. Gentle care extends beyond dementia care. It means tailoring individual care plans to each resident's specific needs and wishes to maximize quality of life, agency, comfort, and personal dignity. Gentle care is at the heart of what we do at Fairmount. So looking at our BPSO journey and some of the first steps that we took, we applied to become a BPSO pre-designate in the fall of 2023, and we were accepted April 2024, and there began our BPSO journey. At the time of our application, we agreed to implement clinical pathways, and one of our initial challenges was that we lacked a full understanding of what it entailed and how the two programs relate. We'll discuss a bit more about that later and what we have learned through this process. Next, we organized our team. Many of you may be considering becoming a BPSO pre-designate, or you may be further along in your journey. But one of the things that we had noticed that in order to be successful, you need a whole team of dedicated individuals within your organization to help support and implement BPGs and influence change. It's also an important first step to ensure your leadership teams are on board. It is essential that management and senior leadership understand or are invested in the journey as well. We were privileged to have immense support from our senior leadership team in starting this journey. We then chose our best practice guidelines to implement. First was person and family-centered care. This is a required BPG by the RNAO, but it is also representative of a foundational BPG and aligns with our gentle care philosophy. To us, person and family-centered care is at the core of long-term care. We also chose transitions in care and services. Again, this was required by the RNAO, but transitions also occur at many points during a resident's life in long-term care, which can be challenging, stressful, and difficult to navigate for the individual and their families. For our third best practice guideline, we chose risk assessment and prevention of pressure injuries. Because the incidence of pressure injuries in our home had consistently been above the provincial average of 2.3% and the provincial goal of 1%. Backed by a strong wound care team, our home had excellent results at managing pressure injuries, but saw a quality improvement initiative to prevent new pressure injuries from developing through assessing and screening risk and developing protocols. Early on in our journey, we recognized the importance of achieving public visibility, which is a strategy to raise awareness of the urgent need for action for a shared concern or strongly desired change. It's a means of sustaining the social movement and a tool to disseminate information to stakeholders, especially through digital platforms. We have, as a home, have used public visibility to raise awareness of and draw attention to the social movement, which is a culture of evidence-based care. We recognized that within the home, there was a culture of doing things the way we've always done things because that's the way we've done them. It showcases that the individual and collective action activities that are happening, which in turn can trigger, expand the engagement of change agents and others. Public visibility can also accelerate change by using social media platforms strategically to frame or position issues. Visibility also helps apply pressure for change and commands responses by others. It supports the credibility and momentum of a social movement by providing ongoing examples of ongoing activity and highlighting the people and the organizations actively engaged in the change. We've used public visibility to engage the community within Fairmount, our residents, staff, management, their families, and the wider public, community partners, the county, and we've used existing communication platforms to do so. We've placed updates and articles on existing facility websites. We've utilized a service called Constant Contact, which is an email service that is sent out to all substitute decision makers home-wide to share information. We continue to put updates in our residents' newsletter called the Gazette that can be read by staff, residents, and their families. We send communication emails to staff, complete presentations, and utilize social media platforms such as Facebook. And we have even looked to our local newspaper to run articles. To further achieve public visibility, you can always look for opportunities to party. We organized our official launch party June 18th, 2024. We invited a wide variety of guests and had terrific attendance, including many residents, many staff, our RNAO coach, Shyla, and members of the County of Frontenac, our local MPP, and the local media. Utilizing your launch party as a way to introduce key terms and ideas such as BPSO, RNAO, BPGs, and the commitment to evidence-based practice and changes is a great way to start. Start working on utilizing the same and consistent language so others know what you are referring to. Our next step was to engage champions. We started engaging champions from the launch party and beyond. We utilized multiple ways of communicating and engaging others to get involved. Emails, posters. We utilized the media screens that we have around our home. Regular touch-based meetings. For example, in our home, we have regular weekly meetings on home areas to discuss ongoing challenges, issues, and upcoming education. Bringing up BPSO and the initiatives that are forthcoming is a great place. That's a great place to do that. BPSO work also can become a standing item at existing committee meetings to elicit excitement and interest in the movement. It's a great place to discuss ways that being involved can encourage meaningful change. And we always say, don't forget about swag. We offered t-shirts, belt bags, and bracelets as a swag for those who had completed their initial training. We noticed that there were periods of engagement, such as right at the beginning, and then the need for re-engagement along the way. In the winter of 2025, we noted that there was funding to complete an open house to showcase current champions and engage future champions. We had a great uptake in champion training initially after our launch party, but as with the busyness of long-term care, everyone gets focused on other activities. So it was a time to re-engage champions and get new champions on board. So we hosted an open house party. We offered more swag and incentives to the current champions who had completed that initial round of training. They received a card, a gift, and their names were placed in a draw for specialized jackets. At our open house party, we had information boards about clinical pathways and BPSO and discussed the changes we have implemented and continue to work toward. The event was well attended and well timed. Staff had expressed an interest in becoming a champion, but many struggled to engage with the online training option. We arranged for an in-person training session for March 2025 by our two coaches. We utilized the lead up to and the event to re-engage staff and attract 23 interested staff members to sign up for and participate in that in-person training. This strategy was very successful. Our in-person champions training had 23 staff attending and completing their training. Staff were excited and engaged with the content. Management and BPSO leads were able to attend the day and were able to hear firsthand the amazing ideas that frontline staff have. I'm going to turn it over to Peyton, who's going to talk about how to stay focused.
Okay, so staying focused is important, not just for all the work that the main leads do behind the scenes, but also to ensure that we're sharing that information on the floor. So some of the ways that we wanted to, stay engaged was quarterly champion meetings. So this gives us the opportunity to receive and provide updates of quality improvement initiatives around the home, learn about new opportunities for involvement that the champions can be a part of. It allows for participation in open discussions to ensure ideas and feedback are relayed back and forth. It's also important to make it fun and inviting, and gives us the opportunity to consider giving the quarterly sessions a creative and engaging name. To reduce formalities, encourage open dialogue, and build a sense of community. Our goal within this is to make champions feel valued, heard, and engaged by boosting their participation and ownership. Meeting quarterly can be challenging and is sometimes difficult, so we continue to work on and strive for this. If you miss a quarterly meeting, find the motivation to work towards meeting that target in the next quarter. Another important aspect with staying focused is streamlined communication. So creating an email chain where all of your champions are a part of it allows you to share updates, coordinate activities, and fosters that peer-to-peer support within the group. It also ensures that all communication is intentional, clear, and purposeful. Regular communication touch points in person are also important. So it allows your internal team to work together in a more personalized way. It also is important to have your clinical pathways team within that, which I'll get into a little bit later. And it's important for both coaches of your RNAO BPSO journey, as well as your clinical pathway coaches, to be involved at the same time as well. The purpose of this is to maintain alignment, address challenges early, and ensure the consistent progress. Leadership alignment is also important. Anna did mention that our senior leadership team was very supportive of our journey. By holding regular leadership meetings, it allows us to keep everyone informed of the different stages of the organization. It aligns our goals and our strategies with the broader Fairmont community and ensures consistent messaging across our teams. We also noted that champion involvement in our QI initiatives around the home is important. So we have been inviting champions to participate in our quality initiatives and also relevant committees around the home, leveraging their passion for change and commitment to best practices across all areas of the home. We're also hoping to consider hosting an annual champion celebration, hosting an annual appreciation event such as a potluck or a tea time gathering, allows us to recognize the contributions of the champions, celebrate their success, and strengthen team spirit. Moving on to clinical pathways. So clinical pathways are structured multidisciplinary care plans that outline essential steps in the care for residents with specific clinical problems. They're designated to standardize care, improve outcomes, and promote resident-centered approach. Our documentation system, Point Click Care, supports the implementation and tracking of these pathways. We started clinical pathways a year after starting our BPSO journey, and we will later get into what we learned from that. Some pre-implementation requirements before going live. There are several foundational elements that must be in place. As such, your governance structure, so you want to define your leadership roles and responsibility. Your education plan, which will outline how you will inform and engage staff about the upcoming culture shifts. Sustainability and evaluation plan to ensure long-term success and continuous improvement, as well as gap analysis, which identify current practices versus best practices to highlight the areas for improvement. Gap analysis is a high-level review that helps pinpoint discrepancies between current workflows and desired best practice outcomes. So when you start clinical pathways, there are 3 foundational pathways that you have to implement first, such are admissions, delirium, and resident and family-centered care. These serve as a foundation for future pathway development. Education and engagement is really important when speaking of clinical pathways. Education sessions are critical both before and after the go-live implementation date of the pathway. Frontline staff provide valuable insights into practical implementation and often identify gaps more effectively than our management team. Many sessions using real-life scenarios provide highly effective in preparing staff. Follow-up sessions a few weeks post-implementation has also helped us address concerns and reinforce expectations, as well as note some gaps in how the clinical pathways work specifically within our Fairmount community. Broader education is also important when speaking to clinical pathways, as all nursing and care staff must be educated on updated tasks and language changes. The entire home must be aligned with the culture shift towards a more resident-focused environment. So clinical pathways, what went well for us? It did improve our workflow. Pathways streamlined the workflow, especially during our admissions, leading to more efficient and effective care delivery. It aligned closely with our existing philosophy. As Anna mentioned earlier, our home follows a gentle care philosophy, which aligns really well with resident-centered language and culture of the pathways. This allowed us to build on our current practices rather than starting from scratch. Staff engagement is another important point that we would say went well. Staff were enthusiastic about the pathways, recognizing their alignment with our care philosophy and the potential improved workflow. This enthusiasm facilitated a smooth transition and buy-in, especially when speaking to workflow. A more efficient workflow, you're going to get people more involved. Leadership on the floor was also important. So we assigned dedicated leads for each pathway, which was a major success. These leads provided real-time support, education, and leadership, distributing responsibility beyond the management team. Getting frontline staff involved and being a part of that transition onto the floor allows for a more smooth transition and open communication. Integrating with our BPSO. So the clinical pathways are grounded in best practice, aligning well with our BPSO journey. The additional in-house education further boosted staff confidence and competence. Oh God.
Thanks, Peyton. I'm just going to speak briefly to some of the results we've already seen. As you can see from the graph, if you want to go back, but yeah, thanks, Peyton. When we started our journey with BPSO, our incidence of pressure injuries was above 6%. And as we discussed, that was far above the provincial average and provincial goal. Since initiating both the best practice guideline prevention and assessment of pressure injuries and the admission clinical pathways, our incidence of pressure injuries has dropped drastically to just above 2%. Prior to 2024, every new admission received a Braden score upon admission, but the information was not being utilized in a standardized and purposeful way. Through the admission clinical pathway, every resident is now assigned a PERS score. Our wound care team developed protocols to be implemented based on a resident's PERS score to direct nursing and allied health interventions and appropriate internal referrals. Do you want to put the slide forward, Peyton? Thanks. PERS scores are also generated quarterly through MDS assessments, and the proper referrals are made as a result. Our wound care program is a great example of how both the work of your BPSO team and clinical pathways can be synergistic toward your end goals. I would like to thank Niagara for sharing their resources and assisting in developing these protocols. We will talk in a bit about creating partnerships with other homes as being an important aspect of being successful with your BPSO journey.
So throughout both of these journeys, there was some lessons learned that we would like to share with you guys, specifically between the linking our BPSO with our clinical pathways. So starting our BPSO and clinical pathways journey simultaneously, it may have initially seemed daunting as they are two large programs, but after reflecting, we feel it would have been beneficial to start both of them at the same time. We learned that these initiatives should be integrated together rather than managed separately. It's also important to reflect on linking your BPGs to the pathways. Clinical pathways have a very specific timeline for implementation. So request this information when selecting your BPGs so you can align your work in both. For example, we chose prevention and assessment of pressure ulcers, which Anna reviewed, but the first clinical pathway that we were required to implement was the delirium one, and our skin and wound pathway will not be for a little bit. So it may have been more fruitful to align our BPSO work BPG with the BPG, dementia, depression, and delirium, as we would be implementing that clinical pathway earlier. So you are meeting a lot of your deliverables. Early engagement and involvement. Engage staff early, even during the initial discussions about pathways. Instead of having those discussions behind the scenes with your management team, try and engage staff right from the get-go. Many were unfamiliar with the concept and its benefits, so early education is crucial. Multidisciplinary involvement is also extremely important, not just, again, your nursing staff. You want to involve your support service staff, as there's a large culture shift, especially with the language change. Implementation should not fall solely on nursing, as I just mentioned, and involving multiple disciplines supports the culture shift and enhanced collaboration. Resident and family involvement is also important. Involving both resident and family councils from the beginning fosters transparency and trust between staff and those we serve and care for. Their input has been invaluable in shaping the pathways that truly reflect our resident needs. Asking questions and seeking guidance. Ask questions, start early, and continue to ask questions along the way. Start your BPSO and clinical pathways at the same time. Request a meeting with both coaches early on to better understand both programs' expectations and deliverables. Seeking guidance is also important. Talk to other homes about implementing both clinical pathways and becoming a BPSO at the same time. It was not until we were in the thick of implementing both that we realized this was not the norm. If you are considering starting your journey with one or both, reach out to homes who have gone through the process and understand the challenges that may exist. Also, developing a network of homes to lean on and refer to. We are a mid-sized home, but there are much larger organizations with access to great resources, and all are very happy to share policies, tools, and guides. Start collaborating and developing a network early on. It's also important to assess capacity early on as well. If you are starting to entertain the idea of joining BPSO movement or implementing clinical pathways, assess the capacity within your home to take something on like this. There are usually 1 to 2 leads for BPSO and 1 to 2 leads for clinical pathways, but it requires commitment, dedication, and buy-in from the whole team to make it successful. Taking the critical step to ensure it is the right time for your home to implement these things allows for a significant improvement of both. It was really important that we did have 2 leads for BPSO that had designated time to work specifically to BPSO. Both of these programs are not something that you can kind of just tack onto your normal workflow. It really has to be supported from senior leadership to ensure that it's supported, that you have time away from your current duties to solely focus on the deliverables and things that you need to move forward with both clinical pathways and your BPSO journey. Any questions for us?
Well, thank you so much, Anna and Peyton, for sharing about the integrating of clinical pathways into your BPSO journey. There's so much to learn from all the success that your organization has achieved, as well as those lessons learned. I'm going to open it up to our audience here. Is there any questions at all? You can just utilize the chat, and Anna and Peyton would be happy to address your questions. Okay. I have a question on, you really had a great list of lessons learned, and as you're going through them, it's so important really to reflect on that and then to debrief about that. And it's a great opportunity that you're sharing those lessons with us. What was your biggest challenge through those lessons, would you say?
I believe I would say probably our biggest challenge was knowing what we didn't know going into it. There's things and supports that really help out. I mean, being a bit into our practice now, you're obviously able to shape how you implement, like for instance, the next pathways for clinical pathways, if I'm speaking to that it allowed me to be more, or our team to be more organized moving forward, because you don't know what you don't know, especially prior to a go live date. So I would say that was probably our biggest challenge.
Yeah, that's a very, very good point, Peyton. Anna, do you want to add anything to that?
Yeah, I was just going to say back to what Peyton had kind of said at the end with the lessons learned is if you're starting your BPSO journey or you're even just in the contemplation phase of applying, it is helpful to talk to other homes and starting that network and seeing the challenges that they faced so you can be a bit better prepared. Because I would agree, knowing what we didn't know it was a big challenge. And we have learned with each new phase along the way. But reflecting back, some things could have been a little bit easier managed had we made those connections earlier on, especially making the connections with homes that are willing to share their resources. there's a lot of great information out there, protocols that are already developed, policies that are already developed. So rather than, trying to spend a ton of time reinventing the wheel, you can kind of lean on other organizations to help you.
Yes, that's great. And you're right. I mean, to really tap into your network, or you can ask your coach who could maybe mentor you through this part of your journey and such. And it's a really, really good point. Um, so on that topic as well, how did you balance your BPSO and clinical pathways work with all of the operational needs that are still needing to attend to?
I think, as Peyton said or mentioned, having your leads in both clinical pathways and BPSO, having dedicated time to do that work is really, really helpful. It can be really challenging to try to focus in on BPSO work and then be interrupted 10 times. So having that dedicated time, and which requires support from your leadership team that support you having that dedicated time, is really, really important. I think also leaning on frontline floor staff who can help is really, really important. As we talked about, you have a few leads for each program, but it really takes the whole team to buy into the ideas, the movements, the change to make it really stick. So that's another aspect. And then I think giving yourself some grace, knowing that long-term care is challenging and you have moments in long-term care where things like your BPSO work may take a back seat for a period of time, while other things take a priority, but then just making it purposeful to refocus and get the team back on board when those sorts of challenges come up, is really, really important.
Yes, for sure, Anna. Thank you. That is such great perspective. Peyton, do you have anything to add to that on just really fitting in and balancing the BPSO clinical pathway work with the operational needs of the home?
Anna pretty much touched on the points specifically of having the leads. With clinical pathways, it was important to get the floor staff involved because they're the ones that are on the floor doing the work. So a lot of clinical pathways, there are sections where it will tell you to go to your organizational policy. So those are the best people to tell you what will work best when they are implemented versus us trying to deduce that behind the scenes. It also allows frontline staff to feel really comfortable going to their colleagues and talking about how we can improve the pathway. And it gives people, once it is live on the floor, I mean, you're doing a lot of train the trainer, which is also important, and then just allows for a more smooth knowledge translation and open and honest communication between the team.
Great advice. Thank you so much. Well, we've had such a great discussion today. And as we prepare to wrap up today's webinar, I would like to thank everyone for taking the time out of your day to take part in this webinar and to be here. Thank you, Anna and Peyton, for sharing with us your journey. It's so important to those lessons learned for you to share, as well as all of your great achievements. And we celebrate with you on those wonderful achievements. Feel free to reach out to us if you have any questions. For those of you who are participating in this live webinar, you will soon receive a link to an online survey to evaluate today's presentation. After you have done this evaluation, you will receive your certificate of attendance. In addition, please let us know of any suggested topics you would like us to work on for the future. Please know that this work is funded by the Government of Ontario. Again, thank you so much for joining us today, and we do hope that you'll enjoy the rest of your day. Thank you again, Peyton and Anna. A pleasure.
Thank you.
Thank you.
Bye for now. Thanks, Verity.